OneWorld Community Health Centers are known for their open-door approach. Access is at the heart of what OneWorld does.
Services are quite varied. We've talked about some of them on the Morning Blend. Today, the topic is midwifery.
And our guests are both certified nurse midwives, Penny West and Courtney Cowerden.
Nice to meet
stopping by this
you.
morning.
Hi, Courtney.
And the term is midwifery, right?
It is,
It's not
yes.
midwifery, it's midwifery.
We've learned.
We've learned the hard way. So what does a midwife do?
That's a good question, and one that we get asked quite often.
I bet.
So basically, we're nurses who have gone on to get our master's degree in nursing. So we are nurse practitioners who went to school to specialize in women's health and obstetrics.
So are these just, I mean, is it prenatal care? Is that the gist of what you do? Who can see a midwife?
Yeah, so that's the bulk of what we do, but we also take care of women basically through the lifespan, is how we like to say it. So most of the time we're spent with ladies who are having babies, but the other time we're spent with women who maybe are getting ready to have a baby or are done having their children. And anyone can see a midwife for things other than obstetrics. We have to have a low-risk patient profile as far as when we're delivering their babies.
Sure, sure. So what is a prenatal visit? What does it look like when you're talking about prenatal care? Mother-to-be comes in for a prenatal checkup.
Well, you know, as midwives, we kind of like to approach it in a holistic manner, meaning we like to look at the whole woman, her whole experience. And so a lot of times we think prenatal care actually starts before the woman gets pregnant. So at her well woman exam, when we see her, we're talking about ideal body weight, regular exercise, supplementation with folic acid to get her ready. And then when she does come back with a positive pregnancy test, we start her care. And a prenatal visit basically is just to check in for mom and baby. We do vital signs for mom. We measure the belly and listen to the baby's heartbeat. But then we spend the rest of the time on education, you know, how to have a healthy pregnancy, how to prepare for the delivery.
Especially if it's your first. There are so many questions.
And I didn't realize a woman can see a midwife prior to getting pregnant. I didn't realize that aspect of it.
Yeah, we actually have a lot of women that come and see us. Sometimes they start with us for their prenatal care, but then they come back for their postpartum visit and then continue on year after year for their well woman exams.
Would you explain to us then the benefits of midwifery compared to going a different route for some of those needs?
Yeah, so I guess what's different about a midwife, and especially at OneWorld, you know, we're kind of a one-stop shop, and so they can come in and see us, and we'll refer them to like dentistry or pharmacy or the WIC clinic. That's all there on site. But some benefits of coming to a midwife is we take more time with our patients because you know, we really feel like education is a really important part of healthcare.
And can I say, as a patient, sometimes if you feel like you're getting rushed out of there, you don't ask questions that you do need answers to, and then you go home and you're still confused and concerned.
You have to have a list of questions because you have a limited amount of time.
And just like get through it fast and I'm out of here because they've got a waiting room full and I've got to go. But I think what you're saying, the time about it, and to something else that you said a bit ago, it's about the entire experience for that patient, not just having a singular focus, but how are they doing overall.
And the holistic approach, can you expand on that a little bit more?
Yeah, so we like to look at the patient not just as a woman who's having a baby. She's a mom, or potentially going to be a mom, she's a mother, she's a sister, she's a wife. So, and she's got other things going on in her life besides just having her baby. So I think at OneWorld, as Penny was touching on, we have lots of resources for other things that are going on, maybe social aspects or financial aspects that they need help with.
OneWorld is built on this foundation of access. What do you notice the difference that's making in our community as people realize you're available, you're there to help, they understand just how much you offer? What kind of change are you seeing in the community from that standpoint?
In particular to prenatal care, early access to prenatal care and frequent access is what can hopefully then have a healthy pregnancy and a healthy baby. And so when women don't get that early access, it can lead to preterm delivery, low birth weight babies, and other complications that maybe we would have caught before. And that leads to increased health costs as well. So the whole thing, starting with a healthy mom and baby, is why we want people to come in early.
Yeah, in a nutshell, OneWorld, Omaha.org, that's the website, but expand a little bit on the services. It's not just a woman who's having a baby.
The phone number there, in case you'd like to call, 734-4110. We have one address on the screen, but that's not the only place in our area where you'll find a OneWorld clinic. So visit that site if you'd like to learn more about just how many people they're able to reach. And we appreciate you both for being here today. Thank you, Kenny and Courtney.
Nice to meet you.
Good to see you.
This show is about to take a food turn.
We're going to check out a roly-poly zucchini. I hope it knows we're calling it that, and see what else is in season at the Village Point Farmers Market. Don't call me that, please.